Hello everyone, I am Dr. B.V. Balachandra. I am a consultant pediatrician and allergy asthma specialist. Today, I am going to teach you how to prepare an epinephrine and keep it ready for usage. Why is it necessary? We are living in a country where in India, we don't have an EpiPen. EpiPen is a very important life-saving medicine to be taken during anaphylaxis, wherein a patient might have 2 to 5 minutes before he has to take an epinephrine, which can make a difference between life and death. Now, anaphylaxis happens all over the country, all over the globe, but most of the developed countries like Europe, US, they have an EpiPen. They have an automated injector wherein whenever there is a situation of an anaphylaxis, patients are taught how to use it and it has saved millions of lives. Now, same thing, anaphylaxis happens in our country in India. We have epinephrine, but we don't have an auto injector. And because of that, lots of lives are lost. Now, I'll show you how to prepare an epinephrine and give it to your patients so that it can be life-saving. This procedure is to be taught to me by my professor, Dr. P.K. Vedantan. I have given this epinephrine to several of my patients, and honestly, I should tell that it has saved 3 lives, and those children are alive today only because of this method. Okay, this injection taking doesn't mean that you can take the injection at stay home during the anaphylaxis. Take the injection and rush back to your hospital, nearest hospital, as soon as possible. Also, I would say that whenever you have a possibility, buy an epinephrine auto-injector and keep it with you. But if you don't have it, this might be your life-saving chance. Now, we all know that epinephrine costs only 20 rupees, but an auto-injector costs around 7 or 8,000. Now, the same medicine can be life-saving. So, how to keep it ready? Many of the times, patients are told, take this injection, go to your nearest hospital and take this injection. You might have an anaphylaxis in a place where you might not have nearest hospital. You don't know where to go. And when you go also, they might not be very convincing to use this unless they are very sure that it's an anaphylaxis. So now see, this is an epinephrine. I would say I'm giving an anaphylaxis preparation for an adult who is about 50 kg. So I would be giving 0.5 ml of epinephrine, 1 in 1000. So this is how I prepare. That's what I would suggest you to prepare. This is a 2 cc syringe wherein I take 0.5 ml of epinephrine. Okay. So now I would change this needle, put another sterile needle. Okay. So this is now epinephrine which is ready. You need to label this. Why it is important is epinephrine is light sensitive, but epinephrine is not temperature sensitive. That means you can use it, keep it in room temperature, but if you expose it to the light, it loses its potency. So by labeling it, you are actually covering the epinephrine. So you are covering. On the cover, you have written that medicine name, dosage, as well as date of expiry. Now, this much, how do you keep it safely wherever you want to go? This is an spectacle box. Now, this spectacle box will help you to keep this injection safely. Another thing is, in spite of your instructions, patient may not be kind of a mentally prepared. You need to teach them how to use this in your clinic itself. You need to tell them you have to use this injection only on the thigh, in the mid part of the thigh, little anterolaterally. Okay, go deep inside and then push the syringe. When we teach them 2 or 3 times, the patients learn it very easily. And along with that, what we do is, in a piece of paper, we give all the instructions like what does this contain and how much is the dosage and how to use it, a picture of how to use this, and that paper we insert it into this particular spectacle box so that when they are they want to know, they can just open it and read it. So now we place the paper inside and then keep the syringe Following that, now this is like kind of a patient can carry anywhere. We give this like 2 or 3 injections. It doesn't cost much. One is kept in the maybe school bag or office bag, one is kept in the car, one is kept in the house. So hopefully the day doesn't come that they need to use, but if the day comes, this will be a life saving. So I hope till we have EpiPen in India, we have to somehow manage like this, but with an instruction after taking the injection, go to the nearest doctor and tell him that you have taken the injection and this is what your symptoms are. Thank you.